Rhinoplasty. You do a lot of rhinoplasty. One of your favorite procedures?
I love rhinoplasty, Randy. It is the procedure in my practice that challenges me the most. And another thing about rhinoplasty that I love about it is each one is different. I can honestly say that in 20 years of doing rhinoplasty, not one procedure that I've done has been identical to another. There has always been a little twist involved.
Most guys don't like to do, I interview plastic surgeons from all over the country, right? And a lot of them don't like to do nasal surgery.
Yeah.
They like to do everything else.
Yeah.
What's your take on that? Because you like it.
I do, and I think the reason why I like it, Randy, is because of my background and my educational background. Now, you remember we talked about earlier that I'm double board certified in otolaryngology.
That's ENT, right?
That's correct. Otolaryngology, ENT, head and neck surgery, and in facial plastic surgery. So I've taken the nose apart and I've put it back together. So with that knowledge, I have a good understanding of what will allow the patient to have an aesthetic nose that functions the way the patient wants it to function. A good rhinoplasty is said to be found in the eyes of the patient, Randy. That patient should be able to see their before and after, and their eyes pop out, because the dorsal hump or the twist of the nose, or the bulbous tip, is not distracting the person looking at the picture. So what does a person do? Naturally, they look at the eyes. That's why a good rhinoplasty is found in the eyes of the patient. This is why I think this is one of the most beautiful procedures that we have in plastic surgery. And let me say this, one of the most incredibly profound procedures. Let me just show you the power that is found in a rhinoplasty. I had a patient who came to me. She had finished her first year in college, Randy, and her grade point average was a 2.5. And she came in with her mother and father, and like most rhinoplasty patients that are younger, that are disturbed by their appearance, they tend to be quiet, and the mother and father does most of the talking. I took the patient, examined her, put her on the video imager, which was incredibly powerful for her. It gave her the opportunity to see the result. Make a long story short, we ended up doing a chin implant and a rhinoplasty on her. Okay. I saw her 1 year later. She came back in. Once again, big smile on her face, had that little bit of I don't know if they make those shoes that have the clouds in them, but she was walking like lighter than air. And I said, Lisa, what's going on? She goes, Dr. Greco, just want to let you know, I had a really good year this year. My grade point average was a 3.5. And I said, I'm so happy for you, Lisa. She said to me that since her procedure, she has renewed self-confidence and self-esteem, and she feels as if she can do anything. And she has this energy and this confidence that is dramatic compared to that quiet person I first met when she came in for her original interview.
So if you don't like your nose, do something about it.
Absolutely. Absolutely.